get a ton of momentum, okay? So it's actually, so I'm going to use my core because it's hard to turn your core off. But you really want this head, I mean, it is really forceful, right? The way they're moving their head back and forth. Really, really rapid, really fast, and really forceful, okay? And then they kind of end in that roll, okay? So here, you know, and it is this ugly thing. Their hands are underneath them. Their legs have flopped in some strange position, right? So then we have to figure out how we're going to get the patient out of that position. But a patient with a C6 level injury can be independent with rolling, okay, in that fashion, okay? They have the potential, okay? That doesn't mean, when you think about functional potential, that does not mean that every patient is going to meet that potential, but the potential is there, right? It is possible. So you think about your patients that have comorbidities, right? Your patients that come in, maybe they have obesity, maybe they have COPD, maybe they had some prior thing that was in their functional ability, that, you know, causes them to now have very, very limited endurance. So those are patients that may or may not necessarily meet that functional potential, right? So we're taking all of those pieces into consideration. So that is C6, okay? If I wanted to, so what we're showing you for all of these skills is kind of the end skill, okay? So this is the end skill for a patient. I am not going to start off day one teaching my patient the end skill of rolling, right? For all of the reasons that we talked about in lab. First of all, they might be in a halo or some sort of other stabilization device, right? They're probably just not going to really be ready for that. But you know, what we're showing you is the end stage. So what we want you guys to think through as you kind of go through practicing this is think through the steps to the pieces of it. So what might I start a patient? If I wanted to make that a little easier, how could I start a patient?
Just moving sideline or
sideline, right? So I might not necessarily start in the full supine position. I might start halfway and try to teach them the skill there, right? So you guys kind of know all those little kind of tricks to help make things easier. We just want to make sure that you're not forgetting to go back and think about those, okay? So again, you know, you're not starting off here, you're ending here for the patient, okay? So for C7, you're going to do kind of a similar strategy, but just think about, you're going to have your triceps, so you're really going to be able to get a lot of momentum there with your arms, okay? So you're really going to be able to get that leverage there that the patient needs to be able to roll, okay? So if I could have someone hop up here for just 1 minute, I'll kind of show you how you would facilitate that.